Hey everyone, Robert here, and it's May 2nd, 2020. Yesterday, I watched Governor Cuomo of New York give his news briefing to the COVID-19, the coronavirus situation as is happening in his state, and something caught my ear. Take a listen.
So, gives you a snapshot of where the cases are coming from, but we need more specific information to have a specific battle plan. Literally, where do the new cases come from? Are they essential workers? Are they people who are staying home and getting infected by a family member? Or are they essential workers who are still traveling and possibly getting infected at work? Where do they work? How do they commute? Is this a question of getting infected on public transportation? We just announced new subway buses, Long Island Railroad, Metro North, protocols. Where in the state are these people who are being transferred from a nursing home? What's their sex? What's their age? What's their previous health status? What are the demographics? Let's get more specific information from the hospitals to see if we can come up with a strategy that is more tailored to the reduction of these 1,000 cases per day.
Did you happen to catch that? Governor Cuomo is wanting to get demographic data. Now, I can understand location, where they work, all of that sort of thing, but this sounds like the Kansas City, Missouri's Plan 10-10-10 to get not only contact information, but also to get demographic data, which can include your household income, education, can include how many children you have. It's a lot like census data and can get a lot more in depth. Now, what you can do with this demographic data is you can create a profile of an individual. That profile will enable whoever has that data to basically predict what you are going to be doing or do given a certain situation, which allows the person to have the data to come up with, I hate to use the word countermeasures, but they're able to come up with countermeasures, they're able to come up with plans that will best suit you giving the data to the government, and I don't like that.
And then we want schools to start now developing a plan to reopen. And the plan has to have protocols in place that incorporate everything that we are now doing in society and everything that we learned.
To further go along with my concern, Governor Cuomo basically said in that little news clip is that he wanted to continue and use the process for the data collection that they are doing in society, or what they are wanting to do in their area, which includes demographics, collection of demographic data, and he wants to incorporate that within the school system. Now, demographic data collection within school systems is something completely different, but we get just as in-depth, if not more so, as to what that information will be. And my question is, you don't need in-depth demographic information on a child unless you are wanting to do something more with that. The COVID-19 only requires a certain amount, but I just am curious as to what the information they're wanting to require. To me, it sounds a little insidious.
We stay socially distanced, but we stay spiritually connected. New Yorkers have been so supportive of each other. You can feel it. There's a spirit of community and mutuality. People are there to help one another. People understand that everybody's going through this. Everybody's in stress. You look at the way people have complied with these rules, as annoying as they are. Masks, 6 feet, this. That's out of respect one for the other. I love the metaphor of the mask. The mask does not protect me. I wear the mask to protect you.
I loved what Governor Cuomo did here. I mean, not approving, but I know what he did. He is basically lumping everything that he said before, the use of data collection, the use of control measures, the use of all these things, into a moral argument or an ethical plea to the audience. He is basically lumping it all into those two words, socially distanced, spiritually connected, and also giving a tangible thing for this particular thing into the face masks. It lumps it all together so that if you do not comply as a citizen of New York, if you do not comply with the measures that he set up, giving your data, giving your demographic information, giving up all this stuff, allowing your kids to give up this information, you are a bad person. You are not a spiritual person, and that taps into a deep-rooted thing of wanting us to be good for the God that New Yorkers envision in their mind. If you do not comply with what the government says, you are a bad person, and that is a brilliant piece of manipulation. Well done, Governor Cuomo.
Last one. Go ahead.
Hospitals have to report to the state where people are coming from when they're sick, the COVID, their addresses, occupation. We're now 2 months into this outbreak. Why didn't we require that sooner when we could have tracked it more, I guess, feasibly?
We have some of the information, but this is now going to be an extraordinary, when I get on the phone with the hospitals, they're going to say this is an extraordinary reporting requirement, right? You had emergency rooms that were overwhelmed. You had administrators who were overwhelmed, working 24 hours a day. To get this level of granular detail on people who are walking in the door and get it to us on a nightly basis, this is going to be a significant administrative burden on them. Are they essential workers? There's no such thing as an essential worker before this. How do they commute? That's a question that I don't think has ever been asked of a patient before, you know. If you are an essential worker, where do you work? You know, these are not questions that the healthcare system ever asks. But since it's down to 1,000 new cases per day, I'm going to say to the hospitals, I understand it's a burden, but it's 1,000 people statewide. It's only several hundred in downstate New York. I understand the burden. The volume is a little lower. This is a little granular. It is more detailed than anything you've ever done. But it's important for us to get it now so we can come up with a more specific targeted plan.
He wasn't able to get the data that he wanted before because the technological infrastructure has not been set up yet within that area or within that country to be able to do that. People are still having to get all of this information basically by hand. Now, the target, as he said, is so low that they are able to get that now and not be so much of a burden to the staff that needs to collect this data. But the thing that we need to remember and understand is that you can collect a certain pool of information, a small pool of information, and extrapolate the democratic data to a larger area. This is what we do whenever we create models in marketing, models with regard to this virus, economic marketing. You pool a certain amount of people that gives you a high enough diversity within that pool, and you are able to extrapolate your data to a much, much larger group. So the only reason why he's requiring this now is because of the lack of the technical infrastructure that we do not have at this time to be able to grab that data. It's being done by hand, and they can get what they need. Why does he need all of this data? What is the purpose of all the demographic data? What is the purpose of getting the demographic data from children? Why do you need to give your financial household income, where you work, all of these things? I would love to see a list, an exact and detailed list of all the demographic data that he is going to be asking the people of New York to give if they are sick. I know this sounds a little like tinfoil hat type of thing. But what I'm seeing states doing, governors doing, and mayors doing is collecting data that is not needed. Data gives people who have it control. It gives them control over a population. It gives them a plan of action to plan contingencies should people say no to the rules that are there. To me, this data should not be in the hands of anyone. They should have only what they need for this virus, and they do not need any more. And we should still have a freedom to say no to Governor Cuomo and to anyone else who wants all of this data for their research. And that's the way that I feel about it.